Hi everyone, welcome to my video about some sharing of how to study SOE and answering techniques. To me, preparing SOE is even harder than MCQ paper. For most of the content, you have to understand the concept in order to explain it clearly in exam. For instance, pharmacokinetic concepts, time constant, rate constant, and compartment models. There are other instances where learning by rote is a better option, if not the only option, like the MAC values, saturated vapor pressure, gas partition coefficient. Try to summarize each topic and make them as brief and concise as possible, which could help consolidate your memory. For pharmacology, I recommend everyone to use a standard framework for studying core anesthetic drugs. Use a framework of chemical properties, manufacturer preparation, mechanism of action, clinical uses, pharmacokinetics including absorption, distribution, metabolism, elimination, pharmacodynamics which further divided into organ systems. This helps your revision as well as answering SOE in an organized way. Practice on a lot of drawings while you study. Not only because you need to draw during the SOE, it also helps you memorizing better. Do know what are important labels on the diagrams, the X and Y axis, intersection point, important numbers. I will do a separate video later about what to look for in drawing diagrams. Apart from practicing with your peers, do revision by repeatedly testing yourself to reinforce your memory. For example, by trying answering sample questions in Dr. Podcast and see how far you are from the standard answer. Here are a few tips for answering SOE. Listen carefully to what you are being asked. If you get asked, tell me about propofol, then you could go through the standard framework of answering drugs, like I mentioned earlier on. But if you are being asked to tell the metabolism of morphine, do go straight for the money instead of hoovering irrelevant details. You are encouraged to use tables and diagrams to answer during SOE. For instance, if you are comparing physical properties of sevoflurane and isoflurane, it helps a lot when you quickly draw a table while you talk and spill the numbers. You don't have to explain the clinical significance of each number until you get asked. If you drill too much into the details on the first question, you might run out of time to score the second and third parts of each question. The examiner will always guide you through the exam, but you have to listen and answer precisely. So here's some example of way to structurize your answer. You could classify according to body systems, time of onset, or you could classify different factors like patients or anesthetics or surgical factors. For instance, if you get asked about effect of pneumoperitoneum and Trendelenburg position on our body during operation, it's easy to classify your answer according to systems. So you could start by saying pneumoperitoneum has impact on multiple systems, with cardiovascular system and respiratory systems being most significant. For cardiovascular, it reduces venous return, causing reduction in preload, and hence reduced cardiac output. This activates the sympathetic nervous system, causing reflex tachycardia and vasoconstriction. Respiratory system, it causes reduction in FRC, it worsens the VQ mismatch, and the CO2 absorption increases the CO2 tension, stimulating the chemoreceptors and causing hyperventilation. So these answer structures could be applied to questions like effects of PEEP or effects of proning on our body. Another way to classify is by the time of onset. For example, if you get asked about what factors do high altitude have on our body, we could classify the effects into acute, which include hypoxia, triggering chemoreceptors and cause hyperventilation, stimulated sympathetic nervous system causing tachycardia and increased vasotone, and increase in 2,3-DPG, shifting the oxyhemoglobin dissociation curve to the right. While chronic effects are the hypoxic pulmonary vasoconstriction causing the right heart failure, increase in the hematocrit, capillary proliferation, and increased mitochondrial and enzyme activities. There are questions that you could classify more than a way. For instance, a question about physiological changes upon massive blood loss. You could classify according to body systems again, but you might end up finding everything is about cardiovascular and neuroendocrine system. In this case, I would classify according to timeline, where autonomic reflex being immediate response, with neuroendocrine and humoral responses being late response. So my message here is that there is no model structured answer for every question. It depends upon yourself finding the best way to memorize and to explain the details in a clear way. For questions that ask about factors that determine something, for instance, what determines FRC, we could classify into patient's factor and anesthetic factors. Patient's factors could be further divided into physiological factors like age, gender, positioning, as opposed to the pathological diseases like COPD and asthma. This framework could be applied to questions like factors determining the risk of awareness or the risk of increasing the post-op nausea and vomiting. Similar to physiological questions, you can also classify answers for pharmacology by patient's factors, anesthetic factors, and often drugs factors. Another way is to classify by pharmacokinetics and pharmacodynamic factors. Classification for anesthetic drugs is often straightforward. They are usually classified by mechanism of action or chemical properties or existing classification systems. So here is an example of how classify factors according to drugs factors and patients factors. Drugs factors could be pharmaceutical preparation, like tablet, solution, special coating. Physiochemical factors like pKa, pH values, degree of ionization, while patient's factors could be absorption or metabolism related. This could be applied to questions about speed of volatile onset, like cardiac output, FRC, minute ventilation being patient's factors, while partial pressure, fresh gas flow, second gas effect being drugs factors. Another common way for pharmacological answers is pharmacokinetics and pharmacodynamics structure. Pharmacokinetics includes everything about absorption, distribution, metabolism, elimination, while pharmacodynamics is all about receptors, like their affinity, numbers available, presence of antagonist. Structured answers for measurements and monitorings is more tricky because these topics are relatively scattered and incoherent. So here is some of my suggestions on how to classify measurement methods. Again, this is merely a suggestion, while you can always classify in your own way. The reason I emphasize so much on trying to classify answer is that SOE is an impression marking. You can score either 0, 1, or 2, which is max, and there is no box to tick in the marking scheme. If the examiner thinks your answer is average, he or she would score you 1. If you answer clearly in a way that he thinks you understand the topic really well, you score 2. Even if you are unable to give all the details, by giving a clear framework of an answer would give you, the examiner, a very good impression that you know your stuff really well and score you high. So my take-home message is that always, while you do the revision, try to structurize your answer and get prepared for the exam. Thank you very much.